Happy morning to one and all. I'm Elayaraja, counseling psychologist and proprietor of Kavithalyaa Counseling Center, a psychology clinic at Ambattur and Chennai 53. Thank you so much, the administration of B.S. Abdur Rahman Crescent Institute of Science and Technology, School of Science, and my special thanks to Dr. S. Emalata, Professor and Dean, Dr. S. Farida Beham, and Dr. C. Simon Thurairaj for giving me an opportunity to present emotional well-being during this e-learning to you all. I am blessed to be here. So I have planned this webinar for 45 minutes to 50 minutes. So it will not be on a basis of any theoretical aspects. It will be on a take-home message. So I request all the participants to have earplugs and focus what I'm saying. So it will be so helpful for you to implement on your daily life. By the end of the March 2020, almost 180 countries have closed down all their schools and colleges, and it has been affected almost 87.4% of learners worldwide. There are government has taking their best to give their education remotely, but still it includes a technology and people it finding very difficult for them to learn on this COVID-19 time. So that is how we're going to see like how the e-learning can make ourselves to best learn about the concept. We all aware like only some private institution are offering online education to the students, and other low income or a government institution are finding it very difficult to provide their e-learning to their students. Let's see in specific our challenges and stress on this e-learning. Not every student has a computer or a fast streaming internet because they find very slow net connections. The students were not able to download the material sent by the institute or by other professionals. So they finding it, they will request other people, they request other friends to download the content. So we have to be on online every hour. So students are finding it very difficult, and because the attendance has been marked accordingly, the students feel stressful to look at the phone and computer screen all the day. Before that, we all used to say like the screening time for mobile or the laptop for entertainment purpose is allowed only for half an hour to 1 hour will be the healthiest way to maintain our mental hygiene. But nowadays, this COVID-19 has changed the scenario. So we all into this screen for almost all the day. So that is why it creates stress for few students, and many students nowadays are survey on 1 GB or 2 GB in between for their daily data plans, in which the present academic training methodology is not quite sufficient for this GB. So they also finds difficulties in managing with these GBs too. So as a professors, as a teacher, we all know like education is not about the class, it is about the interactions, it is about the broadening of ideas and free floating or free flowing open discussion, debates and mentoring of each students, which is obviously absent as of now. So we find it very difficult to monitor how the students as of now on other side of e-learning. The greatest disadvantage of online teaching is eye contact. We are missing it as of now. That's also becoming a huge stress to most of the professors and online teachers. The loss of human connectivity, some students feel like they are doing a correspondence course. But anyhow, as a student or as an educator, we need to adjust and adapt with the changing environment. That is how we can able to survey in this world. So the advantages of the e-learning is the ability to learn using the different online tools and method. Nowadays I can able to see the different methodology that students are using to learn. The professors are using the different technology to make them upgraded to give the best to the students. No interruption in the learning because of the pandemic. So at any cost, at their convenient time, the students can listen to the content again and again if they want. That is why they can able to listen whenever they needed, even in their leisure time. The technology can enable the different teaching methodologies and also allow teaching a large number of people across the countries. This is one of the sound things that we can able to feel during this COVID-19. So as a whole, it is our perception, like whether we take it this e-learning as an advantages or disadvantages. But as an professionals, we suggest you to change according to the changing environment. So there are myths, there are disadvantages, there are advantages too. Let's be positive to take best from online teaching. So apart from this, we're going to see how our mental health plays major role nowadays. I know like there are few people who have seen or who have attended major webinar on mental health, altogether focus on different aspects of a mental hygiene. So this session may be the same or few people may find different. The first is mental health. As of now, for the past 80 days plus, it is very common for all of us to feel some sort of emotional distress, say for example, stress, worry, anxiety, boredom, or even a low mood. This is all very common nowadays, so nothing to worry at all. It is not like only you or I feel like it is almost most of the people feels the same. So what is stressful to you accordingly, or what is stressful to us as of now? There are people feel like there is a decline in the quality of learning. Of course, as we discussed before, it is always we have some disadvantages that we cannot able to give a full-fledged content over the on learning. And there are people who have been addicted to the smoking, tobacco chewing and other sort of narcotic drugs. And there are many people who have been into a boredom because they have been into the home for 24/7. Every Sundays is almost for 7 days. The people don't know what to do, how to make them time more constructive. And most of the people have find loss of with the regular contacts with the friends. They find it losing it being with them for all the day or even in the every evening. So they feels like they cannot able to see them, and all the parents who have been restricting not their son or daughter to go elsewhere to meet any peoples. As of now, they feel disconnected with the humans, even though they talk over the telephone. And there are more people who I find very difficult to migrate to their hometown, especially from our area to the north zone. And emotional changes, as we discussed, there are people who have been having fluctuations of their moods. Some people are being happy and some people have been sad all the time. Uncertainty about the examination, and this is $1 million question, and no one knows when the examination is going to start and how they're going to present. And today we got the results from CBSE school examination, so it is all unpredictable. Hopefully over the future the positive things will happen and everything will get changed automatically. And excessive use of mobile or behavioral addiction. So usually we used to say before like we need to use a mobile constructively, and nowadays there is no option, like every mobile and laptop is being used extensively for education for any sort of purpose. So the internet usage, the internet misuse addiction is also getting increased. And feeling of overwhelm, a sudden use of technology. This is very common even for the senior citizens or professors who have been using much technology nowadays, has been finding stressful to them, because some may find difficult to their recording their audio, sometimes the videos, all it plays a major stress for them. Sometimes we plan of actually doing the video, but uploading the video, it's all plays a major role nowadays, and that's also feeling stress for few people. Depression, especially the one of the symptoms of sleeplessness, people finding it very difficult to sleep. I know a case, is a student of 18 years, is a male student. Yes, sleep pattern has been completely changed. His appetite has been completely changed. He says like, what I'm going to do if I wake up in the morning, all the days are same. So I don't know what work I'm going to do. I'm feeling monotonous with all the work. learning, sleeping, eating, and everything. So his sleep pattern has been completely changed, in which he felt low. Feeling of emptiness, of course, there are few people feel like, and major of the people fear of hospitalization. Say for example, for any sort of physical disease, even for a fever, they find it very difficult to admit because of fear of infection. And there are people has anxiety about the health, especially again like getting COVID-19 or coronavirus, especially hypochondriasis. Even a small symptom of cough or a mild temperature on their body will make them to feel more about that they may have a COVID-19 disease. Worsening of a pre-existing medical disease, say for example the people who have already the psychiatric issues, say for example anxiety of depression, and nowadays it is worsening well. And there are people who have been having a diabetes or BP, they are also finding it very difficult to cope up as of now. Of course, financial depression, major of the people, working people, have a pay cut or kind of 30%, 40%. This is also making most of the people to find stress nowadays. Feeling of imprisonment, as I told, that we are, as per the state and central government measurement of on health, we need to be into the home for our safety. So that is why we can always see like stay home. So for some people it's like they feel like it is an imprisonment. Distress on managing children, of course on earlier times we used to make them to go to the school, they'll engage them, and nowadays they were into with us for 24/7. There are few mother and father have been finding it very difficult to manage the children, especially on their behavioral issues, or some people who have been into ADHD or attention deficit hyperactive issues, they're finding it very difficult to manage nowadays. There are a bunch of psychopathology, but we're going to see only two psychopathology as of now. The predominant one, and which is commonly found in most of the people. The first is called the depression. So the simplest three symptoms, if you find it for almost most of the day for more than 2 weeks to 2 months, then obviously there is a chance like we may have a depression features. And it is absurd not to label any people as a depression client or a patient. So we can always say like there is a features of a depression to that particular individual. Say for example, if you find any people into the depressed mode, complete loss of a complete sadness all the time, feeling like irritable, depressed mode, yes, they are into a depression. Loss of interest in doing any activities which they've done before. They will never do any activities. That's a sign of depression. And they will feel always low energy, or they get tired all the time. These are the some of the symptoms. It's a screening tool actually. You can able to find whether the individual into a depression phase. Apart from that, I have given you a small self-evaluation. So this questionnaire is about PHQ, Patient Health Questionnaire 9. You can even get it through online. When you do this, when you have more than 2 symptoms, obviously you comes under the mild depression, and more than 3 you comes under the moderate depression, and more than 4 you comes under the severe depression. So let's check ourselves. It is for most of us. Be on the present and answer these questions. If you feel a little interest or pleasure in doing things, if you say yes, of course you are into the features of depression. Are you feeling down and depressed, hopelessness about the future or about the situation? Yes, we are depressed. I'm finding it very difficult to fall asleep, or staying asleep, or sleeping too much a lot. Yes, that comes under the depression features. And if you find so tired and have a very little energy, as we discussed on the previous slide, yes, we are into a depression. If you don't eat, or if you overeat, I know a client, when she is anxious, she order 1,000 rupees through the Swiggy, and he eats sweets a lot. Appetite, overeaters. So that is why we can able to see more emotional eaters nowadays. You can see on UKG or even first standard, second standard itself, you can find more Kung Fu pandas. That's why they eat whenever they get emotions. They eat a lot and they become obese. On those days, when we are into a depression or when we are into a anger, we throw the plates and we'll move on. But nowadays, there are most of the people will take a mobile and kurkure chips and they will eat their food by considering their emotion cannot be balanced. And sixth, if you feel bad about yourself, yes, I'm not fit for anything, I'm always scared, and nothing is working out, then you are into a depression. You cannot able to concentrate on anything, even on watching movies or watching serials or even reading newspaper, or even able to concentrate on your academic stuff. Everything comes under the concentration difficulties. Yes, you are into a depression. Moving or speaking so slowly, sometimes the people talk very less. You can able to find the major changes once these people have been talking very confidently or speaking loud. So now their sound has been reduced, their tone has been reduced, the pitch has been reduced, and few people find very restless throughout the day. They will fidget their raised faced hands and everything, and they will be into a restless mode. And finally, there are few people who have an idea of taking their life away. I mean, suicidal thought, suicidal ideas, suicidal plans. So we should be very careful in evaluating this. So if you have more than 4 symptoms, it is better to seek a professional help. Or one thing, the depression is not just a psychological factors, it also includes the biological components too. So sometimes the severe depression requires medication and counseling. Sometimes the mild and moderate depression requires just and counseling, talk therapy, which includes cognitive behavior therapy. In short, we have no control on the activating event which happened on the past, but we have a control how to think or rethink about the particular situation in which we can able to feel calmness or relaxed. Or another idea is doing your previous activities. Say for example, you have been depressed for 2 months, in the sense you may be doing some activity before the 2 months. Do that activity as of now for 30%, so that 30% will take you to the 50%, 70% and back to the form. Even doing your leisure activity, even doing the previous activity will also makes you some difference. But if we have a suicidal thought, there is no option, we need to get a professional help. The next predominant thing is anxiety. I can able to see out of my clinical experience, there are more geriatric person, I mean the senior citizens I find having with more anxiety. They feel like, as per the studies, they feel like the senior citizens have more option of getting infected if they have a multiple disease or disorders. So there are people who have a dizziness, headaches, shakings. They feel like their body is getting hot or chill. The heartbeat faster. Sometimes they feel numb. They have a back pain. They have a breathing difficulties. They have a stomach upset. Feeling like weak all the time. They will be going into the restroom all the time. Sweating palms. Started to sweat a lot on their armpit. Shuddering or stammering, the visions get blurred, the tension shoulder or stiffed muscles all over the body. If you have the symptoms for more than 3 to 4, obviously we too have anxiety features. The best way to manage the anxiety features, which we're going to see on the next slide. Check yourself. What is actually triggering your anxiety or triggering your emotions? I'll give you one example. There are people who finds difficult to talk in front of a group, and there are people who finds difficult to manage their physical symptom of disease, and there are people who finds anxious about the futures. So let's see how your thought process play a major role in managing your emotions. You need to check the event which is triggering your emotions. Any event which I said before, or you can add any event at your own experience. What is the assumption you are making about that event? You may be thinking about something, this may happen or that may happen. These are all your assumption, which may be irrational or sometimes may be rational. Irrational is something beyond the normalcy. And does your emotion match the fact of your situation, or it is just an assumption? Either it is you thinking about the situations in an dramatically, or it is an actual fact. Now ask yourself, what will happen? You can ask this question to yourself. Nothing actually will happen, but we will think about the various assumptions, like this may happen or that may happen. Some may mock at me, or I'll get a serious disease or whatever. Check yourself how many times that you made this prediction and it has come true. If you check this, I think like only 3% of true persons will come true. And ask yourself, what is the benefit of worrying? If you ask this question to yourself, obviously it is zero. The next slide is about the treating anxiety, and this is also continuing managing your anxiety by doing some relaxation technique. The previous slide is about your thought management, and this is about doing some relaxation techniques which makes you to feel calm. Grounding techniques, I'll tell you on the future slide, so that will be so helpful. JPMR is Jacobson Progressive Muscle Relaxation. So it is a clinical method in which when we are doing this PMR, obviously our anxiety, stress, sleep will get promoted, obviously. So that's a clinically proven method to reduce our anxiety and stress. Deep breathing, absolutely, it makes most of the people sound so good that I will tell you while doing this grounding relaxation technique. Writing a journal. Say for example, if you feel stress, write your thought on a sheet of paper. I always suggest you not to write on your mobile note, just write on your diary or on a single sheet of paper or even a note. What are the thoughts which comes in your mind? How you feel about that particular thought? And third, how you can able to constructively change that particular thought. You feel the psychological changes, obviously you also feel how to manage that stress or anxiety appropriately, because most of the people have the attitude of running away from the problem. I always suggest the best way to solve the problem is to face the problem. And few people have the sleep issues. Don't consider yourself like you have a sleep disorder or insomnia or nothing. Like sleep is a biological need we all will get, obviously. But due to the mobile usage, most of the people, as we all know, like the usage of the mobile is high only after the 9 p.m. So it is best to reduce your mobile usage or a screening time. Basically, you can have your dinner around 8 o'clock before 8 p.m. before 9 to 10 o'clock should be your obvious sleep time. So before going to the bed, read a solid boring books or do a solid deep breathing for 6 to 7 times. Obviously that creates a melatonin sleep hormone. Predominantly if you keep our bedroom well, so actually the bedroom is meant only for sleeping and for that purpose. So apart from that, when we keep our bedroom as a dungeon or keeping in more material, that itself will not make us to sleep peacefully. So see to that your room should be perfectly clean with AC or a fan with the proper ventilations, because the external factor also plays a major role for getting sleep. Next, challenge your negative automatic thoughts. You may be having a serious different thoughts about the particular event. Challenge that thought positively. That will help you to get settled down. Psychoeducate yourself with the professionals, not by yourself with the Google doctor or by scrolling all the web pages. That will create most of the anxiety for many peoples. So never ever use anxiety. Say for example, we had a client who has COVID-19 infections fear. So he started to Google it. So that made him to have a sleep disturbance, that made him to have an obsession about the fear of infection, and he lost doing all day-to-day activities. So it is safe not to overeducate yourself through the Google. Always maintain a social connection. Talk with the best people, friend people who have a best energy, vibrate people that will give you emotional support for you. And focus on the things that you can control and don't focus on the things that you cannot control. There is no use of cursing COVID-19 or coronavirus as of now. It has come and it is our responsibility to manage that. This slide is about COVID-19 fear. So I know like few students or few peoples or few professionals have been checking off the symptoms again and again when they are seeing COVID-19 related news. It is not like that. When you watch the movie for 24 into 7, obviously we will again or we will obviously turn into a COVID-19 patients. So never ever do like that. Some people exaggerate even the mild symptom to the COVID-19 symptom, which is not actually. Anxiety about their own health, especially for their children and for the senior citizen. And of course, this is you can also feel that in your area. Suppose if the area is under the quarantine or isolation, we all get the fear like there is a chance of here testing positive. We know a senior citizen who have been diagnosed with HIV, COVID-19 positive. So obviously the other members are feeling like, oh my God, there is a chance like we may also get positive about this COVID-19. So which is not actually. There are few people, even in the family members, if one is affected with COVID-19, it is not like all has been affected. That we don't know the few reasons, but it is true. And uncertainties related to the job, of course, no one knows what is the financial status for the next 1 or 2 years. Everybody is finding it very difficult, and career, education, business, all has been, yes, it has its own difficulties, but I always suggest you to focus on the present. Let's see what is going to happen on the future. That sounds so good for your mind. And there are few women and men, especially the women, have been finding it so difficult to do the household work as well as the managing the academic work or other official works at their home, because like there are various disturbance, other family members, other work, so has been finding a major disturbance for them to work out. The next comes managing our stress. Of course, the stress is inevitable that everyone will feel at any part of our life. It is not like no one can escape. And as well as I always say to the people, like stress is poison for one people and it is pleasure for other people. Say for example, if we have a power cut at our home, so we feel worried. At the same time, when we find like other neighbors and other peoples have also the power cut, obviously we feel happy. So it is up to us that how we perceive the situations, whether it is a dangerous or painful or it is happy. So we all have a resource to cope up the stress, but the point is how we are using it constructively. And I'm not going to say about what is good stress and bad stress, but I'll tell you one thing. If we have a stress, we need to manage it constructively and not destructively. Constructively means handling it professionally. Destructively means taking alcohol, smoking, suicide, eating absurd. It all plays a major role in managing our emotions disconstructively. Let's see about common prevention strategies for managing our stress. The first one is called thinking technique or a think technique. Whenever some thoughts comes in your mind, talk to yourself whether it is helpful, whether it is inspiring, whether it is necessary or a kind. If you feel like it's no, obviously say stop to yourself, to your mind loudly, put a red signal and try to switch your thought to some constructive things which is happen on your present or on your future. That is called a thought switching or thought stopping technique. We can replace that negative thought with any other thought which has happened on your past. And never ever think like what happens if I lose my job or what happens if I get corona. So that will deteriorate your happiness. So focus on the task which is on the hand and enjoy them. So that is why we always saying like try to be mindful in any activities. Don't think about the future or don't think about the past. This is the best strategy called a worry time. So we as a human have a tendency to worry all the time. So I'll say you, like, say for example, if you want to worry, fix a time from 5 p.m. to 5:30 p.m. That's the only time out of 24 hours that you need to worry. So whenever you feel like to cry or worry, just say to yourself, there is a time at 5 o'clock, let's worry or let's cry. That sounds so good for your emotions, because whenever you carry a stress or you worry about something for 24 into 7, that is why most of the people have a bodily changes from top to the toe. Especially the women have the headache all the time, and few have a neck pain, shoulder pain, chest pain, palpitation, stomach upset or ulcer, knee pain, joint pain, body temperatures, and other sort of bodily changes. All will come about when you keep on viewing or when you keep on perceiving about the situations. Develop worry time. You can engage in any activities which makes you so happy. I know few people have been drawing. They can draw, or they can cook well, or they can do gardening. They can even groom their partners, children, and whatever they want. So don't worry. Even though if you get infected, there are many people who are coming out of this corona virus. So don't worry. Don't watch the news always. All we need is reassurance all the time. So whenever some people reassure us, like, you can either get a reassurance from yourself or from the trusted people, they can support you a lot. Of course, ventilating your emotions to other people also sounds so good, and you can talk your emotion to the trustful person too. I always say, like, moderate, take only the balanced food. That always sounds so good. And drawing sometimes also relieves your stress. And in specific to the appetite, as of now, take vitamin D related food and protein related food. That sounds so good for your mental energy. Physical exercise, of course, that is the cheapest medicine in the world. And of course, there are few people who find difficult to go for a gym. Of course, no gym is open as of now, and they find it very weird to even for a morning walk. I don't think so. People can go for a walk either at your terrace or somewhere place where you can have a social distance. Or there is a one app in the like Google Play Store, Cure Fit. So this is an app that you can able to find some exercise on that. Even the 15 minutes exercise which is given over there under the home exercise or home fit, you can do that. That's also sweats you a lot. So as I said before, be very, very careful on making your assumptions that drag you to the depression or to the anxiety. So sometimes we need to focus on how to adapt to the change. So to continue, forgiveness also plays a major role. Suppose at least we need to forgive. We no option, like we need to forgive this corona COVID-19. Sometimes, like, so that sounds so good, and sometimes we need to forgive other people too. And sometimes it is best to have a small hug within our family members. That's also sounds so good. And pet therapy, we always say it is as an animal assistant therapy. Having a small pet, a cat or dog or even aquarium place sounds so good. And having a sense of humor attitude or a sense of humor characteristics or sense of humor talking with other people or even watching serials which have a sense of humor contents will also secrete your feel good hormone that obviously reduces your bodily changes. And 3 E's, which has been designed for me: eating, exercise and emotions, all these three together major role in managing ourselves and our mental hygiene. Emotions at a right, eating at right, and exercise at right. All these three together makes so good, and it sounds so lot. So the next slide is about the grounding techniques. Here I am going to teach you about deep breathing too. So sit straight. I suggest you to sit straight. Make your back straight. Take a deep breath. 3 times of deep breath. Your method of deep breath should be, you should inhale through the nose slowly. By the time your stomach should bloat up, hold it for 4 to 5 seconds and exhale slowly through your mouth by the time your stomach should goes in. This is called a belly breathing or a diaphragmatic breathing or focusing. So you need to do a deep breathing. On this basis, obviously you can able to feel the present or being mindful. I repeat, inhale through the nose slowly, say for example 8 seconds, hold it for 4 seconds and exhale through your mouth very slowly. While inhaling, your stomach should bloat up. For that, you can keep your right hand on your abdomen and left hand on your chest. Your abdomen hand should bloat up, and while exhaling through the mouth, your hand should comes down on your stomach. So that is all you need to do. Unless and until when you don't focus on this deep breath, you cannot able to do this. So do this deep breath for 2 to 3 times and then follow my instruction now, and you will see some difference on your mindset, and you will make yourself to be on the present, and your anxiety or your thought about something will get reduced. I'm going to repeat. Sit straight. Just see 5 things that you can see in your room. For example, what are all the 5 things that you can see? You can see anything: chair, table, fan, anything. 5 things. Next, what are all the 4 things that you can touch? Touch anything nearby. 4 things that you should touch. What are all the 3 things that you can hear? Yes, sound, AC sound, fan sound, whatever it may be. Next, what are all the 2 things that you can smell? Anything, perfume, room smell, whatever it may be. And what is the 1 thing that you can taste? If you have something on the table, you can take that and feel the taste, or else just visualize some taste, biryani, ice cream, or whatever it may be. I repeat, what are all the 5 things that you can see? What are all the 4 things that you can feel or touch? What are all the 3 things that you can hear? What are all the 2 things that you can smell? And what is the 1 thing that you can taste? We are using all the sense organs. When you are using all the sense organ, obviously we feel much relaxed, and this technique is called 5 4 3 2 1 techniques. So far we have seen constructive way of handling our stress, and now we're going to see a unhealthy way of handling our stress. Of course, we are running out of time, but still, alcohol doesn't help your way of handling your stress. Smoking doesn't help the way of handling your stress. Taking drugs through the pharmacy or through some other reference will not help. Suicidal plays a very major role, and that will not help. Eating or overeating is also will not help you at any cost in managing your emotions. I wish to say one thing in specific to if you have a thought of suicidal. Most of the people says like இது வந்து ஒரு கோழத்தனையான விஷயம் அப்படின்லாம் சொல்லுவாங்க. It is not like that. Your messenger, your chemicals plays a major role. And for suicide, the clinical depression plays a major role, the chronic disease plays a major role, the family plays a major role, both psychological as well as other aspects all plays a major role. So it is up to us, it is up to the society, it is up to the family members to have to visualize some signs if your friends or people have, and help them at the appropriate time. As a matter of fact, if you feel suicidal, just close your mouth and nose for few seconds. You can feel an exhaustion on your breath. Obviously, this stops preventing you from suicide. You can also have a rubber band on your wrist. Just pull it off. You will feel the pain. Obviously, you don't feel like to commit suicide. And not to be in an alone or to be in aloof or in a separate room, because trigger of being suicidal is more when you are being alone. Talk to some people as a usual suggestion by the most of the professional. That sounds so good. Even though when we say these suggestions, I have counted almost 800 clients who have been victimized or who have been came out from the suicidal thought. The most of the people will say is like the death before the 30 seconds, they have a only mindset to kill themselves. We all say like the helpline plays a major role, of course, but the people who have a plan to commit suicide, it is their responsibility to get help from the people. So never ever commit or have a suicidal thought. It is a sin. Even the Buddha says, like, when we commit suicide on the next generation or next era, we need to face any sort of situations at the same phase which you are getting now. So it is better to face a problem appropriately. There are things which settle down immediately. There are problems which settle down at a late or a later, and there are people and there are problems which will never settle down at all. So if it is not settling down, we need to accept. That is where the problem comes, and it is quite normal to get a professional help. And there are people says like going for a counseling, psychology or a psychiatric help is a taboo. No, it is just a talking session. You can feel free as if you are going for a general physician. So you can get a help from the psychologist at the primary level. The psychologist will tell you whether you need a psychiatric advice or not. If the people are talking to themselves and they don't know what's a problem for them and they lack insight about their problem, say for example, there are people to talk themselves, they have a high suicidal, they may feel like someone is watching them. That is all the condition of a schizophrenia, that is a cancer of mind, and they need medications as of now. But predominantly, most of the condition, even the psychologist or a clinical psychologist sounds so good for managing your emotions. And there are some psychopathology which requires both medication, I mean psychiatric medication and counseling. So it is always safe whenever you find any people are taking drug for all the time, suggest them to go for a counseling too, because the tablet will not solve the situation. It is up to the individual to solve the situations. So that will be helped by the psychologist, and think the psychologist will not give you the suggestions or solutions. They will facilitate, they will make you to solve the problem by yourself. That's the motto of a standardized psychologist. And you should be very careful in choosing your friends to share your emotions. I'll tell you one example. So I was feeling like I was in a depression, so I called my best friends and talked for some times. Now we both are into a depressions, so that's called a shared depression. So be careful in sharing. If some people are in a weak personality or they have already into some sort of depression, so never share them. You will make other people also depressed. Finally, be connected to your elderly, because the elder people needs a support from you all. The one thing that you can do for your senior citizen is whenever they are talking to you, give them a sound of yes, yeah, okay, fine. That sounds them so good, that sounds them so supportive. Never ignore them. Never. I know a client, he feels very happy to talk to me. He say like, I can feel happy in talking to you. What I do is just I give my ear, which means I just lend my ears for his issues. That itself make him quite happy. So as a family members, if you have a senior citizen, talk to them, be with them, they'll be so happy. When it comes to the children are happy as of now because they are enjoying this lockdown. But still, few younger children or few children have their own ideologies about this COVID-19, and it is up to the parents to discuss everything calmly. If we don't know the answer appropriately to answer for them, just get them a professional help, because don't misguide them. That creates unnecessary problems. And almost our cell phone has been replaced nowadays with all sort of educations, learning and every stuff. Please don't replace that with your family. It is always suggest to switch off or keep your mobile silent after 9:30 p.m. every day. Yes, of course, what you said is good, but it is very difficult for us to implement, because any sort of stress, e-learning, or a present stress, or a marital stress, or any sort of abuse related stress, or any stress, if you don't attend them properly, there is a chance of cardiovascular disease. We'll get a disease all the time, which means the immune system disease. There is a chance to get asthma, diabetes, digestive disorder called peptic ulcer, psoriasis. For women, they have a chances of premenstrual syndrome, depression, and migraines especially. Finally, we are almost closed at the end. It is our responsibility to come out of the stress. Be happy with the present situations, even though it is a e-learning situation as of now. Make use of best. This will also pass away very soon. Let's try another one, because I always say to most of the people, your assumption or your perception plays a very, very major role on getting a psychological issues or a distress. I'll tell you one story out of this. Suresh was lying in his bed in his bedroom. It is a spacious room with a window just beside his bed, showing a beauty of a nature. Everything was calm and quiet atmosphere here. So suddenly a thief is entering into that room through the window, and he taken all the money, golds and valuable things from the cupboard, and he left through the same window. In spite of watching what was happening in front of his eyes, Suresh did not make any attempt either to stop the thief or call for the help or even to oppose the thief. He was just lying in the bed and as if in his own world. So what could have been for a Suresh for not reacting to the situation? So most of the people, when I put this question, they say like it is someone's house, or the Suresh is blind, or is enjoying the TV serials, and is in the coma stage, or something like. People will have their own answers in their mind. But the actual answer is Suresh is just a 2-month-old baby lying on the bed. See, the problem is same, but how we are, I won't say it's a problem. The situation is same. How we are taking it as a problem or challenges, which is up to us. So e-learning or whatever the problems which comes to you, take this as a positive sense and make it so constructive in managing your mental hygiene. What's this video? This for a stress busting or a stress buster. What's this video? Sometimes you should be very careful in helping others. So thank you so much. Thank you so much for Crescent team for giving me this opportunity, and I request most of the participants to write their feedback on Kavithalyaa Counseling Center on the Google page. You can have a review option in which you can put a star and write your review if you are okay with that presentation. So thank you so much again. Thank you all. Have a great day. Let's all be a warrior and not a warrior.